Good afternoon. Thank you for joining us today. I'm Chris Herbert, the Managing Director of Harvard's Joint Center for Housing Studies, and I'm very pleased to welcome you to the release of our latest report, Housing America's Older Adults 2023. The Center first published a report with this title back in 2014, and in the years since, we've published several updates. But with this year's report, we're committing to release this report every 2 years as a key pillar of our Housing Aging Society program, led by Dr. Jennifer Malinsky, who you'll be hearing from in a few minutes. This program aims to deepen understanding of the implications of aging populations and to advance policy, planning, design, and public health solutions to help ensure equitable access to affordable, accessible, safe, and connected housing for older adults. And as you'll soon hear, today's report makes abundantly clear the rapid growth of households over the age of 80 is making all the more imperative that we recognize and tackle the housing and care needs of this important population. But before we get started, I also want to thank the National Investment Center for Seniors Housing and Care, the sponsor of this year's report, for supporting our research and making this report possible. We're going to kick things off with a presentation report findings from my colleague, Samara Scheckler, who was one of the key authors of the report. And we'll turn it over to her. But after that, we'll have a panel to discuss implication of this year's report and its findings. So with that, let me turn it over to you, Samara.
Thank you, Chris. Up. With the baby boomers on the cusp of turning 80, we anticipate a surge in demand for home modifications and alternative housing options. People will also need services so that they can live safely in their homes. Since the cost of services compound living costs, we frame care in the home as a housing issue. This report, which considers the cost of care and housing in combination, is a first for us, and we believe for the field. U.S. households are aging. There were 58 million people 65 or older in 2022, up 34% from 2012. The center further projects that the number of households headed by a person age 80 or over will more than double between 2021 and 2040. While demographics are changing across geographies, small metro areas and rural communities do have higher concentrations of adults 65 and older, and they may also have limited transportation, broadband, limited access to medical services, and fewer housing options. These community resources matter since older adults are less mobile and the relocation rate is less than a third of younger households. The vast majority of older adults live in homes that they own or rent themselves. In 2021, just over 9% lived in the home of another, often an adult child, and over just 2.5% lived in a group quarter, such as a nursing home. Importantly, more people live at home alone at older ages. At the same time, 1 in 5 older adults live in multi-generational settings. This arrangement, especially more common for older households of color, is often intended to create economic efficiency to exchange care and assistance, or for both reasons. Older adults are more likely than other age groups to own their own homes. The falling home ownership rates for 50 to 64-year-olds do suggest that there are changes on the horizon. In 2022, this high ownership translated to significant home equity, up 47% from 2019. However, huge disparities exist across older households. Compared to the highest income quartile, owners in the bottom income quartile had few assets outside of their home equity, and renters only had 2% of the total wealth of homeowners. Wealth is also unevenly distributed by race and ethnicity. Older Black and Hispanic households reported less than half of the median net wealth of older white households. Budgets can become strained as incomes fall with age, a common trend regardless of tenure status or of race and ethnicity. Compounding this financial strain, older homeowners increasingly carry mortgage debt. Between 1989 and 2022, the share of owners age 80 or over who carry a mortgage jumped tenfold, and the amount of debt they carried increased 750% in real dollars. Worryingly, Nearly 11.2 million older adult households were cost burdened in 2021, meaning they paid 30% or more of their income for housing. This is an all-time high in number, though the share of cost-burdened older adult households has remained stable. Over half of these cost burdens were severe, meaning the housing costs exceeded 50% of income. Cost burdens are more likely for older households with low incomes, for renters, for owners who are carrying a mortgage, for households of color, and for those age 80 or older. You can explore cost burdens by geography in an interactive that we posted on the report's landing page. Federal rental assistance is vital to helping older adults with very low incomes manage their housing costs, but it is not an entitlement. And in 2021, just over a third of income eligible older households actually received a subsidy. In the extreme, unaffordable housing can contribute to homelessness, and 10,000 more older adults experienced sheltered homelessness in 2021 than in 2019. With serious implications for mortality, older unhoused people report poorer health than same-aged housed people or younger unhoused adults. In general, rates of chronic conditions and functional difficulties, such as with mobility or with self-care, increase with age. However, on average, people of color and older adults with lower incomes experience these functional difficulties earlier in life. Functional difficulties make it harder for people to enter their home, to navigate it, and to use it. But less than 4% of households of houses include these three key accessibility features that are single floor living, no step entrance, and extra wide hallways. So modifications are an increasingly important tool because better fit housing can increase independence for people who have mobility difficulties. Mitigations are also needed to protect older adults from rising threats of climate change, including extreme heat and poor air quality. Nearly 70% of older adults will need long-term services and supports at some point. Medicare doesn't cover these services, and most states operate long waiting lists for home supports through Medicaid. Last year, only 7% of care was covered by private insurance. Family assistance is increasingly limited as baby boomers had fewer children, many of whom work full-time. So many older adults will need to pay for the higher cost of care in addition to their housing. However, the cost of daily assistance at home is out of reach for most, and so is assisted living, which bundles housing and care together. While these care settings are not interchangeable, their relative economic efficiency does adjust with local costs. So we found the largest differences in Ogden, Utah, where $54,000 for assisted living was more affordable than care at home. And on the other end, in Bridgeport, Connecticut, where $71,000 for in-home care was the lower cost option. You can compare costs by metro in an interactive that we've posted on our website. We conducted a special analysis of households unlikely to receive public subsidy, but without sufficient income to afford the median price assisted living in their metro. We referred to these as gaps households, as in those in the gap between assisted living and public support. This analysis focused on people aged 75 and older living alone in 75 metro regions for which data were available. On average, GAPS households could only afford 62% of assisted living costs, but this varied widely from metros in Utah and California, where residents were closest to affording this combination of housing and care in assisted living, to metros in North Carolina, Pennsylvania, Ohio, and Michigan, where affordability lagged most significantly. In some cases, home equity can also be used to purchase support and assistance for a period of time, but this option isn't available to renters, and it's limited for owners who have mortgages or for people with partners who also need a place to live. The panel will now take up some of the innovations happening in the housing and care space to reach more older adults who are struggling with this dual burden of housing and care. With that, I'll turn things over to Mark Miller, a journalist and author who specializes in writing about aging and retirement. Mark is a contributor for the New York Times and Reuters and the author of a book, Retirement Reboot. All yours, Mark.
Thank you, Samara, and great to be here. Before we get started, I'd like to just briefly introduce our panelists, and you can find their full biographies on the center's website. And for the panelists, if each of you could now also turn on your cameras and your microphones as well. First, joining us is Jennifer Malinsky, who's project director of the Housing and Aging Society program at the Joint Center and lead author of this year's report. Also joining us is Elizabeth Chen, who is Massachusetts Secretary of Elder Affairs. Megan Rose, General Counsel and Chief Government Affairs Officer for Leading Age California, is with us, and Bob Kramer, co-founder and strategic advisor at the National Investment Center for Seniors Housing and Care. Thanks to all of you for being here today. For those of you who are watching on Zoom, you can join the conversation on the platform formerly known as Twitter with the hashtag Harvard Housing Report. Jen, let me start by asking you to talk about the highlighting in the report of the fact that as the US population ages rapidly, it's not just low-income older adults who are finding it difficult to cover the cost of both housing and care and services, but also middle-income older adults are going to struggle as well. What's happening there and why?
Well, thanks, Mark. So housing and long-term care services are both expensive. On the housing side, we know, as Samara just said, a third of older adults are paying more than a third of their income for housing. Half of those are paying more than 50%. And people are more likely to struggle with affordability in their 80s and beyond because incomes are fixed or declining in older age, making it harder for renters to keep up with rising rents and even for owners to keep up with the rising costs of taxes, utilities, and insurance, to say nothing of the growing number who are still paying off mortgages. But at the same time, people in their 80s and above are more likely to need those services and supports. I want to make sure to say this, it's a wonderful thing that the older population is growing overall and people are living longer than a generation ago, but the supports that people need to stay in the community, to stay in their home are really expensive and hard to secure. So simply put, that combined cost of housing and daily care are beyond the means of most people, not just people with very low incomes, but also a growing number of people with more moderate and middle incomes.
Yeah, I think a lot of listeners will find that finding provocative and perhaps somewhat surprising. Secretary Chen, Massachusetts is fairly cutting edge when it comes to support services for older adults and could in some ways be a model for other states that want to innovate and create new programs. Could you talk a little bit about the housing supports available for older adults in Massachusetts?
Sure. Thank you. And thank you for having me on this program today. So I want to talk about two particular supports that we have. One is called the Resident Services Coordinators. These are place-based coordinators in senior affordable housing properties. They're available to all residents. The Executive Office of Elder Affairs pays for the presence of these individuals. And we have found that this particular supportive housing model reduces costs to EMS, it reduces emergency room visits, and it can reduce hospital admissions. Now, how do we do that? Place-based, trusted person on site. This person can provide on-site health education and wellness programs, recreational adult learning activities, connect people with assistance, provide some care coordination, some transitions management from acute hospital care back home, for example, or rehab back home. They arrange for group dining in some of the common rooms because loneliness is an issue, and many older adults live alone, and it's much better when people have eyes on each other, develop friendships, and I think food tastes better when we're eating it with other people. There's an after-hours emergency response system to triage anything that's a non-maintenance issue, and this is probably the piece that reduces the calls to 911. And so the supportive housing model that we have enables older adults to live in and engage in their communities. So these are largely individuals living in senior affordable housing properties. There's another model, some of you may be familiar with this model. It's called PACE, which is the Program for All-Inclusive Care for the Elderly. It's a federal program, and eligible participants, are older adults who are age 55 and older and living in the community and have high service needs. PACE is organized and defined as a provider organization. So the healthcare provider, primary care physician, is both the care provider as well as the group is the PACE group is the insurer for individuals. And so we have seen independent senior housing built to specifically with a certain number of units set aside for PACE eligible individuals. And that provides that on-site care for people who have that high level need of care. And some locations even have a PACE tenant selection preference in private assisted housing. And so we're seeing that piece more and more throughout Massachusetts.
And with these programs you're describing, what does it take to get some of these programs in place? Are there challenges in terms of either regulatory changes or coalition building?
Well, I don't know that they are so much in that they're barriers. We provide funding, and at this point, it's probably a workforce issue. We're all facing workforce constraints. We want to find the right person for every single building. And that person has to be armed with a lot of knowledge about access to a lot of different programs and be very interested in serving older adults and providing the coordination and and really getting to know the people in the building. So I would say workforce is a constraint.
Okay. Megan, cost burdens among older adults, that is, as mentioned earlier, people who are spending more than 30% of their income on housing, is at an all-time high. How does this report help inform the work you're doing in California to address the issue of housing cost burdens among the older adult population there?
Hi, thank you so much for having me. The work that we're doing in California largely centers around ending and preventing homelessness, increasing the supply of affordable housing for older adults, and really breaking down those silos that exist between our health and housing systems. And so over the years, we have relied heavily on iterations of this senior housing report. It's really one of the only data sources that we've had that shows the growing needs of our older adult population in terms of their housing needs. And so for years, the data in these reports have pointed to this oncoming older adult homelessness crisis that we now find ourselves in. In California, we will have 623,000 new older adult renter households by 2040. And so the data in this report really helps us understand the housing needs of this population so that hopefully we can start thinking really strategically about how to address them. And I think a critical highlight of this report is that it really, kind of presents that need for many types of affordable housing. We like to say there's no one solution to ending our housing crisis. Older adults, like people of all ages, deserve options. They deserve to be able to age in a home of their choice, whether that's an affordable apartment in a community with other older adults, or a home that they've owned for years but needs accessibility modifications, or an ADU in a loved one's backyard. So a couple years ago, California adopted a master plan for aging, which calls out this need for housing options for older adults. But I, truly think that if we're actually going to do this, if we're going to create these options, we need to recognize and appreciate the unique needs that we all have as we age, and really prioritize these housing options that encourage healthy aging. And I really think that this report is going to help us in that advocacy to do that.
And on the question of homelessness in older adults, I know from just some previous stories I've reported that it can be really difficult to get good specific data on just the scope of the problem. I mean, what can you tell us about that maybe in California? Is there good information about the total number of unhoused people in the state?
It's gotten a lot better. And I would honestly say that Harvard JCHS has really led the way in that data. There weren't a lot of other outlets reporting on data specifically relating to older adults, housing, and homelessness. I think that they have helped really move the needle in this shift to start collecting data based on age. I think we've seen that with HUD's point in time count. And I think a lot of our localities in California are now starting to look at advanced age as a kind of a factor in needs once becoming unhoused, and also preventing homelessness. And so, yeah, I think that it's a huge, we've seen huge growth in the data available around older adult homelessness.
Mm-hmm. I wanted to ask you a follow-up question about the master plan on aging as well, because I know that's a very kind of leading edge, important initiative. How far along is it? I know, as you said, it was announced a couple of years ago, but where does it stand?
Yeah, so I hope I'm not getting the dates wrong because the pandemic was a bit of a blur, but if my memory serves correctly, it was released in early 2021. So we're coming up on the 3-year anniversary of the release of the Master Plan for Aging. And each year it gets a refresh. So, as our world and economy evolves, I think our Master Plan for Aging is evolving too, to make sure that we're constantly updating to address needs as they currently stand.
I see. Bob, let me turn to you. Long-term care services are very expensive, as we've discussed earlier, averaging more than $100 a day nationwide. Of course, that varies a lot regionally, but the majority of older adults are going to need these services, but most can't afford them. What would you say can be done to address this mismatch between the long-term care services and what people can afford?
Well, thanks, Mark, for the question, and it's great to be here and be on this panel. I would say quickly 3 things, and then I'll elaborate a little on each. The first is to educate and inform. The second is to communicate, collaborate, and partner. And the third is to innovate and scale. So the first, educate and inform. It's why NIC funded the original Forgotten Middle study with Newark at the University of Chicago in 2019, because you can't really address a problem that people aren't even aware of, that it's hidden. And many people simply weren't aware that there was this huge group that didn't qualify for government support programs in housing and in long-term care, but couldn't afford most options out there, whether in their home, private pay options, or whether they were in a senior housing community. And so it's shining that spotlight. And that's why we were so excited to provide the funding for this report. And it's why I'm thrilled that Harvard has focused on this dual burden, because I think this is a huge step to go from just looking at housing, Mark, to looking at housing and care together. Because again, we're educating and informing, hopefully, the media and policymakers, but also individual citizens, both older adults and their adult children. What kinds of discussions are we having? Are we starting to think about this? And then with that, as we look to do that and educate and inform, I think one of the things this report brings out is that, I think previously many probably felt assisted living, senior housing is too expensive for me. I'll just stay home, it's cheaper. Well, that's not necessarily the case, as this report shows. And the challenge is that getting the long-term care services you need together with having safe and secure housing is unaffordable to many, not just to low-income individuals. So that means then, secondly, we've got to communicate and we've got to collaborate and partner. What do I mean? Well, just think about housing and healthcare. We have 2 separate federal agencies, But more importantly, we have a raft of programs. Those programs often have different eligibility requirements, different criteria, even different language and different terminology. So you need to hire an expert just to navigate what you're eligible for, what works how. And so communication, collaboration, and partnership, and that's housing and healthcare. I would say the missing piece in that is community. Who's in the community? Community service, local providers, and they're more likely to understand the dynamics of that local community. And when you just bring housing and healthcare, that doesn't produce health. The missing ingredient is that sense of community and purpose and belonging. So, and then the third area is innovate and scale. And by that, what I mean is this is not, and this report makes clear, the options going forward cannot be pitted one against one another. We need everything. We need more options for people to choose and that people can afford in whether they want to stay home or whether they want to move into different settings. So for instance, Secretary Chen has mentioned the PACE model, which is without question, and seeing how a PACE-like model might reach what I'd call the lower half of the forgotten middle could be a really exciting development if we could do that. Or if you look at it in terms of multi-generational housing, well, in terms of that, you look at ADUs, alternative dwelling units, and getting rid of restrictive zoning. And the work that's being done in California, in Massachusetts, and other places with age-friendly cities and age-friendly states. Well, one of the criteria is that kind of multi-generational living is made possible and feasible rather than really, frankly, discriminated against. A third area would be, within this would be co-housing and efforts in co-housing. Just recently, we saw Care House in Baltimore, the US's first intergenerational care-based co-housing project, a really exciting project that provides housing for caregivers and their families, as well as providing housing for disabled adults and frail older adults. So, and then within, you see all kinds of now what you might even call roommate matching services or golden girl type services. You see Upside and Nesterly and so forth. And then within senior living, you're seeing moves now to how might we use a universal worker concept? How might we use technology to reduce costs? And what might be the role of the residents themselves in taking more charge of their health and in oftentimes volunteering as a way to reduce the costs in the senior living setting. So the point is, this report educates and informs the fact that wherever you want it, that combination of housing and care is really expensive, and we need innovation and scale, and we need to collaborate on solutions.
PACE has come up a couple of times already in this conversation. And Bob, the last time I did any reporting on it, it seemed like it was promising, but still rather small in terms of total scale around the country. Can you, either you or Secretary Chen, if you want to comment, either of you, on, is it picking up? If not, why aren't programs like that growing more rapidly?
Well, Secretary Chen, if you'd like to go first, please go ahead. I would always defer to the Secretary. So.
Oh, thank you. It is picking up in Massachusetts. We have made a concerted effort to make sure that every community has access to a PACE program. There is also a part that people are not aware of, which is that you don't have to be Medicaid eligible to be on PACE. There is a private pay option, and you pay the Medicaid rate in our state. And so that makes it more affordable for the middle income households, which, for example, might have already paid off their homes. And without a mortgage, you can privately pay for the PACE and have the supports in place. PACE is really wonderful, really, really wonderful. They believe in the wraparound services that are needed. They the PACE will pay for a lot of things that are not considered medical, but really, really help individuals remain tenancy in the community. Go ahead.
Yeah, and I would, from a national perspective, absolutely concur with Secretary Chen. What I'm seeing, and I serve as an external advisor to a PACE program, and what I see now is a resurgence of PACE programs. I think they kind of reached an initial threshold, and states, quite frankly, were fearful. They were fearful of making more opportunities available. And it was kind of the old woodwork. There was a sense that it would end up costing them more. And now I think what we're seeing is a real sense of urgency to A, to address this population, and B, to realize that, quite frankly, PACE works. It combines housing, enabling people to stay in their homes safely longer, but it combines it with preventative healthcare and management of chronic conditions, and it provides it through the PACE Center with community. I at a recent PACE Center opening, well, about a year ago now in Washington, D.C. in Anacostia, and I had the opportunity to interview individually each of the first 10 enrollees in the program, and their excitement and that local community's excitement that this was now an option in their community was positively infectious. And I think states are seeing that. You're seeing from Oregon, Ohio, Massachusetts, you know, the number of states now opening up PACE applications is I think, really exciting. There are some issues, for instance, on that buy-in, addressing the Part D issue in terms of prescription drug costs for those that are going to buy in is an issue that has to be addressed. Anyway, I think we're in a period where we sort of had plateaued and we weren't seeing much new movement. I think now, the last year, I'd say the last 2 years, that has markedly changed. And part of that is the data and the research.
Yeah, sounds like it's time for me to revisit the story, or if there are other reporters on the call, maybe you'll want to revisit it as well. Jen, let me go back to you for a minute. Another thing you highlight in this report are the persistent inequities, not just for older adults of color, but between owners and renters. Older renters have only 2% of the net worth of older homeowners, but older Black homeowners have only $123,000 in home equity compared with $251,000 for older white homeowners. So this is a huge, huge gap in equity, literally and in the figurative sense of the term. What's driving these inequities, and what can be done to address them in your view?
In terms of what's driving them, I think it's a very long history of disparities in homeownership, driven in part by policies around mortgage access and the post-war period. Then we have discrimination in and access to employment, education, quality health care that have all shaped these disparities. And many of these disparities compound in older age, so that older people who have had different opportunities throughout their lives, you know, are in a very different place in older age. So today there are persistent gaps in homeownership. Nearly 83% of older white households own their homes compared to 63% of Black households. And the gap between white and Hispanic older adults is nearly as large. But as you point out, even among homeowners, older Black and Hispanic owners have less wealth on the median. And what they do have tends to comprise a larger portion of their total wealth. So more wealth is tied up in the house. Meanwhile, the typical renter has about $10,000 in total wealth, but the typical Black renter has under $4,000 and Hispanic renter under $3,000. So the disparities continue even within those different renting and owner groups. I think that there are long-term ways to begin to address this. First of all, you know, finding ways to help people build wealth inside or outside of ownership is important at younger ages. But in terms of today's older adults, it's important that we find ways to help older homeowners of color protect their investments through assistance with maintenance and repairs. Many older adults who own without a mortgage, you know, forego property insurance, including disaster insurance, and including in areas that are really getting hard hit by climate change related hazards. So addressing the costs of insurance, helping people access that insurance can also help protect the equity they've built, so that they can use that either for themselves or to be able to transfer it to the next generation, which does make a difference in terms of who can become a homeowner down the line.
And I mean, another additional layer to these inequity issues are that the households with higher housing wealth are also the ones that are likely to have retirement savings and higher Social Security benefits. And the converse is true with people with less home equity or renters. So, sort of a pile-on effect there. Am I right?
It is absolutely. And people who have lower income are more dependent on Social Security, which is, of course, fixed. So there's going to be less flexibility there. There's cost of living adjustments, but less flexibility to absorb additional costs that come down the line from needed care, for instance.
Right. Secretary Chen, I wanted to go back to the topic of homelessness with you. Homelessness among older adults, of course, is rising, as we mentioned earlier. Talk about, if you could, what Massachusetts is doing in this area to address the rising older homeless adult population.
Yes, yes, it is in fact rising. We see two sets of stories. One are people who have been unhoused for a long time, for a while, and they have aged into an older adult. And the second group are folks who are newly homeless because they've lost their home due to some event, some large expenditure, possibly the loss of a job, a whole host of issues that may have led to the loss of a home, an apartment, a place to call home. And this group largely are single people with no family or support systems. We're very, very concerned about this group because after the age of 55 and a loss of jobs, I think we all know it gets very, very difficult to secure a new job. And so that's a little bit of a double whammy on folks. And these individuals, when we see them, do not identify as low income because they weren't before. And so there's a little bit of shame when we say, we want to put you on SNAP benefits. And, oh no, that's not for me. We want to put you on the list for housing, for low income housing. Oh no, that is not me. So this is a group we're very worried about. I'm excited about the Healy-Driscoll administration's bill called the Affordable Homes Act. And it authorizes $200 million for an innovation fund, which supports innovative and alternative forms of rental housing that include single person occupancy units and transitional and permanent housing for people experiencing homelessness and housing for seniors and veterans and transitional units for people recovering from substance misuse. And so we're very excited about that. And also in Massachusetts, I think across the country, we have to produce more units. We just have to produce more units of housing. We're all living longer thanks to the magic of modern medicine, and that's good. We need to produce more units. And so as part of this bill will permit the construction of accessory dwelling units with certain criteria. And it just prevents the town-to-town housing board component that has to happen, and that really kind of clogs up the production of accessory dwelling units. So I'm very excited about both of these components.
I mean, that challenge of building additional housing units varies quite a bit in different parts of the country, both in terms of the cost of housing and regulation can be a barrier too, especially in certain parts of the country. Do you have any thoughts on, how in particular high cost areas like in Massachusetts or California for that matter are going to cope with that issue of just the need for more housing stock?
Well, I think in this bill, the accessory dwelling units and having a uniform set of standards for our state. We have 351 communities in Massachusetts, little tiny Massachusetts, and 350 different ways of zoning. And so this provides some uniformity, and that it's a right as long as your ADU meets certain criteria. And, size, owners do not have to occupy it. There are no parking mandates if it's within a half mile of transit, things like that.
I see. Megan, California is reimagining its Medicaid program. Can you tell us a bit about the changes that are being made there, and do the changes create opportunities for addressing housing challenges as a social driver of health?
Yeah, I'm really proud of the work that California has been doing to address the housing needs as a way of improving health outcomes. And as this report highlights, we can't talk about housing older adults without talking about the impact that housing has on our health and longevity. So we have CalAIM, which stands for California Advancing and Innovating in Medi-Cal. And through CalAIM, we're working to ensure that our dually eligible older adults, so those are older adults who are eligible for both Medicare and Medicaid, or as we call it, Medi-Cal, that they are provided a full array of wraparound services that a person may need as they age. And so this is really an effort to fill in the gaps that have historically existed between Medicare and Medi-Cal, kind of the coverage gaps. And so as part of CalAIM, all of our dually eligible people are being moved into managed care through a capitated rate model, which kind of serves to incentivize the plans to be more innovative and help keep their costs down by creating better health outcomes among their participants. And so the state has devised several housing-related Medicaid benefits that managed care organizations can offer to participants. And so some of the more notable offerings include housing transition and navigation services, which is like assistance with finding and securing safe and stable housing, housing deposits, such as first and last month's rent. And then recently, California announced a plan to provide up to 6 months of transitional rent services to eligible individuals who are either experiencing homelessness or at risk of homelessness and who are transferring out of institutional care. So now our focus will really be on trying to prove that cost benefit of providing these services to the managed care organization, so they'll want to offer them to their plan participants. And is this the solution? No, but it's a really good start. I think, Robert mentioned the missing middle, and California has a huge missing middle population. These are individuals who are low resourced, but don't qualify for Medicaid. The report says that 70% of us will need LTSS or long-term services and supports at some point. And so it's happening in California as we have, thousands of people who are low income, but just don't qualify for these wraparound LTSS services that Medi-Cal provides. So what's happening is that they're either delaying care, which leads to increased instances of emergency room visits or premature admission to skilled nursing facilities, which drives up our healthcare costs and typically results in worse health outcomes. Or they're spending down their wealth to qualify for Medicaid. And that has a huge equity impact, particularly on communities with a history of barriers to passing down generational wealth. So we're working with a broad coalition in California to try and imagine and create a public benefit LTSS option, which would help individuals pay for their long-term care needs as they age, and hopefully we will stop forcing people to pay down to qualify for Medi-Cal.
So the managed care component that you mentioned, that's really for the dual eligible Medicaid, Medicare population. And it sounds like you're focusing on doing something additional for the population that's not qualified for Medicaid. Am I getting that right?
Medicare only, we would say, yeah. People who don't quite have meet the income restrictions of Medi-Cal.
And are all these managed care? So it sounds like, are these being done through like the Medicare Advantage program or some combination?
No, through our managed care organization, some of which also have MA plans, but California has kind of certified a number of health plans as managed care organizations that are organizations that have dual special needs plans, D-SNPs, to care for those who are both Medi-Cal and Medicare eligible. So older, low resourced individuals.
I see. Thanks for that. Bob, the topic of loneliness, that's a significant issue among older adults. What do you think are some interventions that we can pursue to support older people, particularly those that are living alone?
Yeah. Well, first of all, I think it's important to realize that loneliness is not an issue, as we certainly saw through COVID, that's unique to older adults. In fact, some of the data shows that some of the highest rates of loneliness, and remember, loneliness is not social isolation. They're two different things. Loneliness is that subjective feeling, and which can be real and obviously overpowering. And social isolation, on the other hand, is living alone. Some people can live alone but feel really connected. Other people can live alone and feel absolutely lonely and isolated. So I would say two things, Mark, in terms of what can we do. And first of all is to connect to people and connect those individuals, solo agers, those living alone now that perhaps didn't live alone before, but connect them to other people. Because just that human to human contact, it can be a phone call, it can be, for a number of years, Meals on Wheels has had a very successful program that recognized how, for those that were, in a sense, shut-ins or at least elderly individuals living alone, that Meals on Wheels person visiting was often a highlight of the day. And then training those Meals on Wheels volunteers in that 20-minute interaction, when they're putting food in the refrigerator, when they're assessing the apartment, to see kind of what were the conditions and what were some warning signs that might be going on. But to the point of loneliness, I saw this with my in-laws, how folks that would come and simply deliver on-demand services into their home became keys. My father-in-law, my mother-in-law was dealing with dementia, but for my father-in-law, that was a highlight of the day, the 20 minutes of conversation that he had. And he looked forward to it every time someone was coming. So it's connecting people, but connecting just by ways of calls, visits, whatever. It's also important to connect with purpose. So you got to connect with people, you've got to connect with purpose. What do I mean? With purpose is we're all wired, I think, to have that need to have a sense of purpose. You can call it belonging, you can call it community. And that ultimately, when I look at a PACE program, when I look at some of the most successful, quote, senior center type programs, what they're doing is providing community. And housing is key to health, but ultimately community is what enables people to feel that taking charge of their health is both possible and worth it. There's a phrase that now has become really popularized with a number of different books and articles written about it, about finding your ikigai, Japanese expression, which literally translates to reason to get up for breakfast. But it's really, what's your purpose? And ultimately, it's connecting individuals, whatever their living situation, not just connecting them with people, but connecting them with purpose. That sense of being part of a community and rediscovering or re-energizing, rather than feeling like life has passed them by and they don't have a positive purpose, giving people a sense of purpose. And so when I look at the best of PACE programs, when I look at the primary care doctor interaction in a ChenMed program, for instance, and I could, many different illustrations like this, it's all, and in the best of senior living communities, it's creating that community that actually really inspires people to have, basically, they're going to have healthier longevity. They're going to have better well span or quality of life.
Well, thank you. Jen, you note in this report that a majority of older adults say that they want to stay in their homes and in their communities as they age. And you and I have talked about this many times, you know, that many surveys out there says most people say they want to age in place, age in place. This is the phrase that kind of, you know, needs to get unpacked, I think. And I think you're doing that in the report. But could you talk about this both from the standpoint of the gaps that exist between these survey findings? Everybody wants to age in place on the one hand, and then on the other hand, the reality of the physical housing stock, and also the gaps in what communities are able to do to support older adults.
Absolutely. Right. So as important as the affordability and as important as the services we've been talking about are, so too is the physical house, that it be safe and that enable people to do everyday tasks that, you know, people who may have mobility and other difficulties that can arise with age. So this goes to safety features in the home, like grab bars, to proper lighting, but also accessibility features, things like a no-step entry that lets people get in and out of the house with ease, because this can be a real barrier to the kinds of things that Bob is talking about. If you can't get out of your house to, you know, join in the activities in your community, that's definitely a barrier we want to address. But very little of our housing in the US offers these basic accessibility features, particularly in the single family homes in which most older adults live. But, you know, again, to Bob's point, accessibility extends to other parts of the environment as well. So for people to take part in their communities and their neighborhoods, we need alternative transportation services. Not everyone drives, not everyone has a car. Safe sidewalks, safe streets, public spaces that are accessible and comfortable to older people. And I'd be remiss not to mention the destinations that support older people's needs and interests and that fulfill that social need for belonging and participation. You know, I guess I would also add to this, part of an age-friendly, age-supportive community is one that has housing options. And there are, you know, a lot of people would be willing to leave their exact house if they could stay in their community in some place that perhaps is more connected, is more able to foster community. And we do see a rising interest in multi-generational settings, things like that, that people talk about as bringing them purpose, proximity to other people. So all of those things are really very important.
Yeah. I've often thought that these types of things are often painted up as challenges or problems, which they are challenges, but it also strikes me that there's a lot of opportunity there, that if we can figure out how to finance some of these things, that there's a lot of opportunity for communities to create new enterprises, new job opportunities, et cetera, that, you know, some of these things are not, they're not strictly problems. They're also, I think, really opportunities for communities. But one follow-up question I wanted to ask you about what you were just discussing, on just the point of people wanting to stay in their homes and the need to adapt those homes. You note in the report that we're seeing a rising share of older homeowners who are carrying mortgages into retirement and into older age, which is an interesting and I think somewhat troubling finding. But can you talk about why that's happening and maybe what the implications are of carrying a lot of mortgage debt into retirement and older age?
Yeah, this is a pretty startling, really. Between 1989 and today, the share of people who are homeowners in their 80s and over carrying mortgages jumped from 3% to 30%. And so that's it. And as Samara mentioned in the presentation, the dollar amount of that debt grew very much, even when adjusted for inflation. So a part of the reason is likely that the last several years have seen very low interest rates, and older adults have had opportunities to refinance, and but perhaps have pushed out the terms of that loan. So if you're starting a 30-year mortgage again in your 50s or 60s, it's obviously pushed out that much further. You know, so for some people, this could have been a deliberate financial decision, but just the fact that so many people with mortgages are cost burdened and paying so much for their housing, it really suggests that for many people, this isn't their first choice. This is their reality, and they're constrained and paying much, much more than their peers who've paid off their mortgages into their 80s and at a time when these other needs are becoming more costly.
Yeah. I also wanted to ask you about the topic of climate change, which is something that I think more and more people in this field are realizing is an issue when we look at the impact of natural disasters, whether it's severe storms in Florida or wildfires in the West, causing an enormous amount of property damage and disruption. And can you talk a little bit about the implications of this for older adults who live in places that are prone to experience these types of disasters?
Yeah, I mean, on several levels, older people are often more vulnerable to these effects of climate-related disasters, extreme heat. So people are more vulnerable to extreme temperatures at older ages. They're more vulnerable to poor air quality, which can come from rising temperatures as well as wildfire smoke. And people's houses can be instrumental in helping to moderate that risk. So, depending on where you are and what that risk is, better sealed windows can improve air quality, or air conditioning is going to become more of a necessity in more parts of the country. So, there's sort of a lot of house-related things that can help protect older adults. But then during these acute events, we know that older adults may be more reliant on regular medical care, or maybe they live in a high rise and are very dependent on that elevator working. So when the power goes out for a week at a time, we have some severe challenges during these events and in the aftermath to make sure that people's needs are met. And at a financial level, just to return to something I said before, we are concerned that people are able to protect their financial investment if they've paid off that mortgage and there's no mortgage company to require them to have insurance against these disasters. That's another concern that we have. And we still, it is true, what Samara said in the presentation, very few older adults, the mobility rate of older adults moving from state to state is very low, especially when you compare it to younger people. But we still see a significant amount of people moving to disaster-prone areas. So this is, obviously an ongoing concern.
Yeah. And then maybe, excuse me, one last question for you, since we're starting to run out of time. Can you talk a little bit about trends in multi-generational living?
Yeah, there's so many. From an extended family sharing a house, to young adults sharing with older people who have extra space, to co-housing and deliberate communities where people maintain their own apartments but live in more communal settings across generations. And this is really driven by an interest in reducing housing costs, to give or provide care across generations, older adults providing childcare and people caring for older adults. But, again, to the point that Bob made, there's a real desire for purpose and community that is driving a lot of these. Some of them take a while to get off the ground. Co-housing communities and things like that are not easy to do, but there's such interest in them. And I'm hopeful that they can help fill out that spectrum of housing options that people are looking for.
Well, there's a lot to dig into here, and we could easily keep going for another few hours, but being observant of the Zoom rules, we're going to leave it there. And I just remind everybody on the call that the full report is available on the Joint Center for Housing Studies website, along with data and interactive maps. And thanks again to Jen and Samara and all of our guests, and to everybody, enjoy the rest of your day.
Thank you.